Hi, I'm Joe Newtoff. I'm going to be demonstrating end range of motion for the glenohumeral joint, the humeral ulnar, radiocarpal, femoral acetabular, and tibiofemoral. Okay, so with the glenohumeral joint, shoulder flexion is going to be bringing it all the way up, and the end feel is muscular stretch. With shoulder adduction, adduction, it'd be a capsular end feel. With shoulder abduction, come all the way up, and it will be a muscle stretch for end feel. With shoulder extension, I'm going to bring her back, and you're going to feel a capsular end feel. External rotation, as far back as possible, is also a capsular end feel. Internal rotation also is a capsular end feel. Now for the humeral ulnar joint, it has flexion and extension. For flexion, I'm going to bring her all the way up, and it'll be a soft tissue end feel. With shoulder or humeral ulnar extension, it will be a bony end feel. With the radiocarpal joint, flexion is capsular end feel. For extension, it is also capsular end feel. With pronation, we will feel a capsular end feel, and also with supination, it is capsular end feel. With ulnar deviation, it's a ligamentous end feel, stretching the RCL, and with radial deviation, it is a ligamentous end feel with the UCL. Now can I have you lay on your stomach? For the femoral acetabular joint, we're going to do hip extension, and she brings her up, and that will be a capsular end feel. Now can you flip on your back, please? Also, we have hip abduction, so as I bring her leg out. The end feel is capsular. With hip adduction, the end field is also capsular. Now, for the tibiofemoral joint, can you sit on the end of the back, please? Knee extension is going to be a capsular end field. And slip on your stomach real quick. For knee flexion, it'll be a soft tissue end feel. Okay, you can stand up for me. Next part, we're going to do exercises for shoulder flexion, knee extension, and ankle dorsiflexion. We're going to be working on passive, active assistive, and active range of motion. So for shoulder flexion, passive range of motion, I'm just going to bring her all the way through without any activation by her part. For active assistive, she's going to also, I'm going to help her through it, but she's going to activate her muscle as well. So we both come up together and come back down. And for active, she will just go up by herself and come back down. With knee extension, same thing. Passive, I'm going to just bring her leg up in the knee extension without any activation by her quads. And then for active assistive, she'll fire her quads, and I'm going to help her through the range of motion. For active, she'll be doing it by herself. Now for the ankle dorsiflexion, passive, I'm going to just bring her ankle up. Active assistive, she'll contract tibialis anterior, and I'm going to help her come up in a dorsiflexion. And for active, she'll do it by herself. Good. And as you go throughout all these exercises, you can increase or put on weight to increase strength. Alright, for part 3 is limitation. So we're going to look at the glenohumeral joint. We're going to go through all ranges of motion to see if she has any limitations. Shoulder adduction within normal limits. Shoulder abduction within normal limits. Shoulder extension is in with normal limits. External rotation within normal limits. Internal rotation within normal limits. Shoulder flexion. She has pain right here in shoulder flexion. So what we want to do is use a goniometer and see how far she gets. The axis is going to be on the head of the humerus. Stationary arm will be the mid-axillary line, and the moving arm will be the with medial in the medial humerus. So I'm going to bring her up. She has pain there. That is at 120 degrees. And normal range of motion for the shoulder flexion is 160 to 170. So what we want to do is help increase range of motion from 120 to about 150 within a week. And we can do this by simply using a broomstick to help increase range of motion. So with her uninjured arm, she'll take it halfway down the stick, push her injured hand on top, and she'll activate her uninjured arm and push upward and helping her shoulder go into shoulder flexion passively to help stretch those ligaments and help it through full range of motion. The muscles that do shoulder flexion, the anterior deltoid, coracobrachialis, and the pec major is the upper 60 degrees. So she has limitations with the muscles. So we're going to do 3 sets of 10 with the broom, and then ice for 20 minutes after every rehabilitation session.